and it looks like it's from fluid in your ears, possibly. So let me check and see if I see fluid there. So how old is he now?
He's 3.
And how many words is he saying? Is he saying a
5
couple
to
words?
10. He says car, cup, go, dad.
Yeah, he has fluid, very, very thick fluid behind his eardrums. So that's what the audiologist, saw on the test, and that's what I'm seeing. We're just looking at this. That's a lot of fluid. So he's not hearing at all with this fluid there. But the nice thing about fluid behind the eardrum is once you get rid of it, their hearing 99% of the time comes back to completely normal, and they catch up pretty quickly with their speech delay. And I would highly suggest, unfortunately, putting tubes in his ears to get a good idea. Let me take a quick peek at his nose and throat.
He slobbers a lot.
Because a lot of times in these older kids, what you'll get is big adenoids as an issue, a lot of nasal sinus problems. You open up real wide, buddy. He has decent sized tonsils. Horrendous. But you see he has all this nasal congestion. Yeah. Is this nasal congestion common, or is this just a bad day for him right now?
No, it's very common.
So I would suggest at the same time we put tubes in his ears, at least we look at the adenoid area to see. His eyes look okay, they're moving well, he doesn't have a lot of redness or congestion there. But from a standpoint of from his nose, by taking out or at least looking at adenoids, and if they're enlarged, removing them, it can help the ears a lot.
The adenoids are
up above the tonsils. And the problem is we all make fluid behind our ears. That's normal. And then it drains down the eustachian tube, the tube that goes from our ear to the back of our nose, right where the adenoids are. So me, you were making this fluid. This is cleaning our ears. But in him, his eustachian tube's not functioning. So that fluid's still made, but it gets stuck behind the eardrum. And so then he can't hear. And then that fluid also gets infected.
So the tubes is what's going
to clear that up. Is a temporary, it's just a detour. What we're trying to do is get rid of the fluid, get him to hear better, but it's still up to his body to develop his own natural tube to drain the fluid off. Because the tubes I put in, they last a year and a half, they fall out. And then after that, it's up to his body and his natural tubes to work.
So eventually, on most kids or cases, does it clear up by itself?
93% of the time it clears up by itself.
Because he's in school for speech, and they've thrown at me autism, they've thrown at me all kinds of different things.
Well, I can't tell you that's not the case, but what I can tell you is you cannot make that diagnosis in a kid who has fluid in their ears.
Yeah.
And has hearing loss.
Because he's not talking.
That's good. You hear that? You can't make that diagnosis.
With fluid in the ears and hearing loss. You have to get rid of the fluid, you have to make sure the hearing is normal. Then, if there's still issues, you can make that diagnosis.
Okay. And that's what we feel like it's just his hearing.
Yeah, most likely, looking at him, most likely it is. But there is that issue. You have to, afterwards, if there's still some developmental delays, things, then making that, doing that assessment may be necessary.
But that's after it's cleared.
After he's hearing well. I actually have time next week on Wednesday, if you'd like, we can do it then.
Yes. Yeah, I need Thursday. Will it be recovery or anything?
1 to 2 days. They have a bad smell from their nose and
so should he
increased nasal congestion, and then it gets better.
So should he miss school?
Yes.
Okay.
It's probably the rest of the week, Wednesday, Thursday, Friday.
Okay.
And recovery is feverish? Is it?
No, he's just fussy. He doesn't know what he wants. It's hard to figure out what he wants.
I'm going out of town Thursday and Friday. He's going to be with Grandpa.
Yeah, so it's, what does he want? What does he want to do? Does he want this? Does he want to go outside?
That's him kind of on a, because he can't speak regular basis. He gets mad at us.
Yeah, so it'll be like that times 2.
Uh-oh. We can do it.
Okay?
Okay.
All right, take this out front and I'll give you some more instructions.
Appreciate you.
You're welcome.